We'll go, Eric, now to our data slides. What we're seeing today, we've actually, this is up. This is the number of cases in the last 24 hours. We had 3 straight days, I believe, where it was under 1,000. And so we were liking that a lot, but now it's flipped back up here. Number of deaths, tragically 22 in the last 24 hours have been reported. Hospitalizations, 86, running about the same as it's been for a 21-day average. The same for ICU admissions, a little bit up, but pretty much the same. So that's the data slides. Let's move to our new. Go to the next slide, Eric. These are our counties ranked by incidence of COVID in the last 14 days, and it's by 100,000. So this is the map we continue to show you. We showed you on Tuesday. This is updated a little bit, but pretty much the same. Let's go, Eric, to the top 10 of those counties. So you'll see, again, as we pointed out on Tuesday, these counties are some of our smaller counties. Mercer County has actually come down a little bit, but still at a very, very high level. And then Darke County is next, Lawrence County, Preble County. Preble is up there now. Meigs County, Sandusky, Shelby, Auglaize, Erie County, and then Perry County. So again, most of these are relatively small counties in our rural parts of the state. So what has happened is we've seen the urban areas that a bigger percentage of people are wearing masks for a longer period of time, and we've seen those numbers come down. Unfortunately, we're seeing the numbers go up in our rural areas. So let's turn to the public health alert system. This is where we were last week. This is where we are today, and you'll see some changes and some things that we're very happy about and some things that we're not happy about. This week we have 9 red counties, the lowest number of red counties since we started the alert system 8 weeks ago. So that's good. 4 new counties have turned red since last week, and 7 though dropped off the red list. The 4 new counties that are red are Clark, Lorain, Preble, and Trumbull. They joined Clermont, Erie, Franklin, Lucas, and Mercer County. We'll go through these. The 7 counties that dropped from red to orange, which is great, off the red list now, Brown County in Southern Ohio, Cuyahoga County, Fairfield County, Licking, Marion, Montgomery, and Muskingum. And as you know, Montgomery and Cuyahoga have been on that red list every single week. They now drop off, and so that is great. Some additional good news: 6 counties dropped from orange to yellow. They are Highland, Huron, Jefferson, Morgan, Richland, and Ross counties. Let's go back now and look at the red counties quickly. And these are in the order in which we have them based upon cases per 100,000 residents in the last 2 weeks. Mercer County stays red this week because of their high number of cases. They are 2.5 times what what's considered by the CDC as a high incidence. They're starting to see a decrease in case numbers, which is good, but they still have the highest number of cases per capita in the state. Their hospitalizations have decreased, and they're continuing to monitor the small outbreaks, but spread throughout the county. Preble County is red for the first time. They meet the CDC's threshold for high incidence, and again, they're at 173, so they're way over that. They had 71 new cases during the past 2 weeks. That compares to a total of 269 for the whole pandemic. So basically 25% of their cases have arisen in the last 2 weeks. Erie County. Erie meets 2 indicators, but they continue to meet the CDC's threshold for high incidence. They're at 129. They had 96 cases during the past 2 weeks. A large outbreak at a long-term care facility is responsible for a significant number of cases. However, there does continue to be community spread throughout the county. Franklin County. Franklin is edging down, and we hope next week that they're no longer red. But they're red because they're at 109 cases per 100,000. Even though Franklin still meets the CDC threshold, their cases, as I said, have in fact been dropping. They've seen a small increase in emergency department visits from 21 visits a day on August 9th to 30 on August 16th. However, their outpatient visits have leveled off. Let me talk about Lucas County. Lucas continues red, but it is almost out of the red. Again, that is good. They have 102 cases per 100,000. They have gone from an average of 22 outpatient visits per day on August 11th to 29 on August 16th. They also meet the CDC threshold for high incidence. However, this number, as I said, has dropped. It was at 159. It's now 102 for the past 2 weeks. Clark County. Clark County is returning to red level this week because they meet 4 indicators and the CDC's threshold for high incidence. They are at 102. They've had 137 new cases during the past 2 weeks. From August 5th to August 17th, the number of outpatient visits for COVID have gone up almost 4 times, from 11 a day to 41 per day. Cases are linked to multiple small workplace outbreaks and a couple of long-term care facilities. The number of small outbreaks suggests that there is spread throughout the community. Lorain County is red for the first time this week. A particular note is their outpatient visits grew from an average of 20 a day on August 7th to almost 28 within a week. Their cases per day went from an average of 18 on August 4th to 24 on August 11th. They are seeing fewer workplace outbreaks, but they're continuing to see community spread. This spread is primarily, we're seeing in social situations, family gatherings where people are unmasked and in close contact and basically let their guard down. Clermont County. Clermont County remains red this week. The county meets 5 indicators. We'll continue to keep an eye on numbers in Clermont County. Although there are limited small outbreaks, the majority of spread is in the community, and health officials told us they're seeing household transmissions. Trumbull County, unfortunately, is returning back to red this week. The county went from an average of 9 cases per day on August 7th to 13 cases per day on August 12th. They've had 115 cases during the past two weeks. They've had a couple of large outbreaks in long-term care facilities involving employees and residents. The majority of the spread is happening within households, according to local health department officials. So what we've seen, again, is the shift, a fundamental shift from the, we're not seeing the increases now in the urban. It's going down primarily in urban, and we're seeing it going up in the rural. Let me talk about some examples. And we use these examples not to shame anybody or to be critical of anyone, but just to kind of is illustrative of how we're seeing spread now in Ohio. In Logan County, at the end of July, there was an outbreak associated with a jazzercise class. Although the studio followed recommended protective measures for when people weren't exercising, masks were allowed to be removed while exercising. There are now 10 cases tied to the outbreak, including one person, very sadly, who is in ICU. Wood County, a sports team had a sleepover at a team member's house, and now there are 9 confirmed cases. Just remind our athletes, as we talked about on Tuesday, that what they do away from practice, what they do away from the competition is just vitally important. Let me turn to the city of Kent, restaurant where bartender was observed to be not wearing a mask at work. The manager of the restaurant said there were health exceptions. That's how it was explained. Bartender became sick with symptoms, had 3 roommates. Boyfriend also tested positive. So this is just not a good situation. Eric, let's look at the education slide. This is a slide that we showed the other day. This is revised, and let's do a slide over here. And again, what is boxed are counties that are red. So the red outline, that means that county is now a red county. Inside that, you'll see the different school districts. And so if it is, they're going to do it fully remote. It's the darkest color up there. I guess that's a dark blue. If it's hybrid, there's this light or that color of blue. And then this is green, and that is the green is those that are returning. They plan to return fully to class, in-person class. And we only show that up there just to alert people, if that's your district and you're going back to class and your county is a red county, obviously the spread does go into the schools. So, going to have to be extra careful, and it's going to be important that everyone in the community try to do everything they can to reduce the incidence of spread in the community. I'm convinced from talking to many superintendents and school officials and teachers that the schools are going to do a very good job trying to keep our kids safe when they go back to school. But if there is significant spread in that community, it's impossible to keep it out of that school. So we all have to work together, everyone in the community, particularly in the schools that are going back in person. If we want to keep our kids going in person, we got to get the spread of COVID down in the community.